Good morning.
Good morning, everyone.
Hi there. My name is Sarah Kelly Palmer.
And I'm Kayla David.
Welcome to Be Well Live. Kayla and I work at Family Service of Rhode Island in the healing department, and we gather here together every other Wednesday as part of our Be Well Live information series where we talk about lots of different topics and how to cope with COVID-19 and also overall wellness topics. For those of you who haven't heard of us, Family Service of Rhode Island is a social service agency that has been serving Rhode Island for over 125 years, and we offer a variety of different services, including telehealth counseling.
So we will be joining together today and every other Wednesday at 10 a.m. for discussions that support wellness during COVID-19 and beyond. So we ask you to please take a moment to share this with your friends or to start a watch party, to share it on YouTube or on Facebook to help us reach as many as we can with this important information about being well during COVID-19. As Sarah was saying, now more than ever, it is important for us to be able to reach out if we're struggling or if a loved one is struggling. Connection is a huge part of overall wellness, and being able to connect to assistance if you're struggling is really important. COVID-19 has put a great deal of stress on us as individuals, on families, on our community, on our nation, and internationally. And this is impacting not only our physical health, but our mental health.
So our topic today, I think, is very timely. In the midst of COVID-19, people are inside more. We're having a lot less to do socially. And a lot of us, many of us, are spending a lot of time online. And what we're seeing is a disturbing trend that has emerged, which we're going to talk about today. Body shaming, weight stigma, and size discrimination have always really been present in our society. But I think, Kayla, in the midst of COVID-19, with the increase of time spent online and social media, I think that's only increasing. And we know that weight stigma, shows up in so many ways throughout our lives and our society. And it's been so ingrained, right, that it is almost impossible to detect until it is actually really called out and specifically pointed out. Size discrimination is ubiquitous to the point of really being normalized.
Mm-hmm. Weight stigma and discrimination negatively impact our mental health just as much as our physical health. With our beauty and diet industry focused on weight loss as self-care, which is a huge, thing that is happening right now, especially during the COVID-19 crisis, as we're seeing a lot of diets being kind of toted to us as ways of taking care of ourselves in the midst of COVID-19. It can be really hard to identify what is actual wellness in taking care of our whole selves in a compassionate way when we are being fed information regarding purchasing certain things to create opportunities for wellness. So we're going to be talking about that today, and we are joined by Krista Handfield and Nicole Marshall Concha to discuss size inclusivity and the impact of size discrimination. Welcome.
Hi.
Hi. Thanks for having us.
Yes, thank you. Krista is a licensed clinical social worker and size inclusive healthcare manager at Thundermist Health Centers. And then we are also joined by Nicole Marshall Concha, who is a licensed mental health counselor and the clinical director of family care community partnerships at FSRI. Thank you both for being on today.
So I'm so excited for today's segment. So let's just start off. I'm hoping Krista and Nicole, you can share a little bit about the work that you are both doing around size inclusivity in our community. Who wants to start? You want me to? Krista, why don't you start? And then, yeah.
Sure. Yeah, no problem. I have two roles in the community. One as a health professional, but also one as a community organizer and body liberation activist. My role as a health professionals at Thundermist Health Center, as you mentioned, where I manage the size inclusive health care team, which is a health equity initiative that is designed to increase access to healthcare and to address the impact of weight stigma on a person's health, regardless of their weight. So this is not weight dependent for weight stigma. It impacts everybody. Through size inclusive care, patients can access primary care providers, therapists, psychiatrists, nurses, community health team professionals to support them to move away from weight as a focus on their health and move towards overall health and healthy behaviors that are available, sustainable, and really not dependent on weight loss to be valuable to our health. And then I also provide therapy in that program. As a community organizer and body liberation activist, I launched a website a number of years ago called shapecenterri.com. And it's a free online resource where I wanted all people who were providing professional services that were size inclusive or not weight discriminatory to be available so that people around and locally could find these folks so that they had places to go and feel safe in their bodies.
Thank you, Krista. Nicole, do you want to share about the work you're doing?
Yeah, so in addition to the work that I'm doing at Family Service, I'm also a trauma therapist. Right now, I'm currently working virtually through day one. And I've worked with a lot of folks who have co-occurring trauma and disordered eating. And just through my personal experience with yo-yo dieting, weight cycling, disordered eating on my own, and that kind of morphed into seeking professional training in the field and helping clients on those very same issues with HAES approach. I know we're going to be talking about that later, an intuitive eating approach, size inclusive, and just fat positive. I think it's really important to be kind of reclaiming that word. And so I'm actually working on right now, starting up a kind of website landing page where people can find me. And I think it's going to be called Fat is My Favorite F Word. I think that's the name.
Oh, I love that.
I'm kind of toying around with, but I think that's going to be, my kind of coaching page. Yeah, because I think it's a pretty radical idea, but it's to Krista's point about liberation, it's so freeing, right? To kind of take back these words that are typically insults, kind of the worst things you could call a person. But reclaiming them is so empowering.
Yeah. Well, we are so excited to get into this conversation today, and I'm hoping that, Krista, can you just share a little bit about what is body shaming for our audience? What is size discrimination, and how does it impact all of us?
Sure. We probably all know what body and even fat shaming is, so they're very connected, is because we've probably all experienced it no matter our size. But it's really it's actively humiliating a person because of their body size, shape, or weight. And it can look like teasing or bullying or harassment. Verbal abuse often includes body shaming. And then it also can be on socials with posts and memes and comments. So it happens in many different ways. Size discrimination is the unequal treatment of people because of their size. And this happens, like a few examples would be, it happens in hiring practices where people are either not hired or are fired because of their size. On average, larger folks make 15% less than their thinner counterparts. So there's a form of size discrimination, but also it can include things like when insurance companies ask folks to pay more depending on their size. So those are ways. Both of them, both body shaming and discrimination and a bunch of other things, are forms of weight stigma. And so how that impacts us is that there's those negative attitudes and actions and the assumptions that are made about a person based simply on their weight is used to control them or harm them, just like other forms of oppression. So weight stigma in and of itself is shown to have negative impacts on a person's health. So not just their mental health, but also their physical health, their social health, and things like body image issues, eating disorders, high blood pressure, depression, isolation, chronic stress. All of these things are are ways that weight stigma shows up for a person and how it impacts them.
And I'm so glad, Krista and Nicole, that we're talking about this today, because this is definitely a topic that does not get enough attention, both kind of professionally within our field, I think, of us all being mental health professionals, as well as kind of more globally, right, throughout society. So we know that a way to advocate for change within our healthcare system, there has been movement that's emerged, right? So this health at every size movement. So Nicole, I'm wondering, for those people who are listening to us or watching this who haven't heard about this idea of health at every size, what does that movement promote, and kind of what does that entail? And why is it important for us to know about it?
Well, I'll start with why it's important. I think now is probably the best time to be bringing this back to the forefront. I think there's a clear intersectionality between what we're talking about with fat phobia and stigma, and how that negatively impacts people in larger bodies as their own sort of marginalized community. And that intersects very clearly with racism, which is also brought back to the fore recently, as well as COVID. You know, as you were talking about when you started the segment, right? This has brought up this kind of renewed body shame and fear of fat, and food restriction and that sort of thing. So it's really perfect timing. So HAES, which is health at every size, is a paradigm to kind of to strike against that. It basically says that it doesn't matter, or it's not a matter of whether or not you have a physical or mental illness, limitation, or disease. It really posits that health exists on this continuum, and it varies with time and circumstance for each individual. So it's highly individualized. And also that health is a resource. It's a capacity that's available to everyone, regardless of their health condition, their ability level, and it's not an outcome or an objective of living. And so the HAES principles, there are 5 of them. I'll just go through them really quickly. It talks about weight inclusivity, so that acceptance and respect. I think respect is really one of the most important pieces there, of really the inherent body diversity that we all have. You know, body shapes and sizes, and rejecting that, you know, idealizing that beauty ideal or the pathologizing of specific weights. Health enhancement. So really, you know, what does that look like for each individual? What does health look like for each person? And then supporting health policies that improve, and to Krista's point, equalizes that access to information and services, right? That everyone is offered the same treatment regardless of their size, and that everyone has the right to kind of dictate what health means to them and what they need. And that's not just on a physical level, but also economic, social, spiritual, emotional, all the things. It also talks about respectful care, which is really about acknowledging our biases. I think a lot more now, which is great. We really work to acknowledge our privilege. So I think that's part of it, and acknowledging our biases, and then working to end that weight discrimination and stigma and bias that Krista was talking about. Eating for well-being is another really important one. I had mentioned intuitive eating before. That's one sort of model. But this really promotes flexibility and individualized eating based on hunger, satiety, nutritional needs, pleasure, right? Like listening to your body intuitively, rather than any sort of externally regulated eating plan focused on weight control. And then life-enhancing movement is the other element, because we see a lot of focus on exercise and rigidity around movement, right? But life-enhancing movement really supports activities that allow people of all sizes and abilities and interests to engage in enjoyable movement that they choose, and to the degree that they choose. So kind of bringing it back to why it's so important right now, I think this kind of concept really enhances social justice, because it creates an inclusive and respectful community, and that supports people of all sizes and finding, compassionate ways to take care of themselves and each other, I think, really emphasizing that kind of community care concept.
And Nicole, hearing you kind of talk about it, like it makes so much sense, right? And you would think like, so why why isn't this how it is? Yet, I think when you kind of look at society and dieting trends and fitness trends and all of those things, those things work directly against what you're kind of talking about here. And I think in the beginning, when we talked a little about how more people, so we're now more connected to our computers more than ever. We're now connected to social media more than ever. What concerning trends are you guys seeing out there during this time when we're all so connected on social media, online?
I can speak to that a little bit. I think that the what I noticed immediately was an increase in fear of fat posts and fat phobic comments, and pictures of people from the Renaissance sort of talking about how this is what my body's going to look like if because of quarantining or staying home, and this and it was really people sharing their fear of what might happen, because people think that when their body is smaller, it represents that they are in control and they are in health. And so when this happened and all of their resources were sort of removed, you could see that internalized stigma, that internalized, fear of fat come out through the way that they were talking about themselves and their experience being at home. And then there were also still the increase in people making fun of and humiliating and talking about other people's bodies as well. But that was something that I recognized very quickly. And then, most people recognize the quarantine 15, right? Which is a play off of the freshman 15. Stigmatic phrase that we use to describe what happens to folks when they go to school, as if a weight shift is a bad thing. So they totally played off of that, and then that became it. So that was an immediate trend that I saw.
I would also say a lot of opportunism, right? So with that comes all of these things popping up around, selling diet schemes that are kind of packaged as wellness. So it's really tricky, right? It kind of tricks us into thinking that this is, aligned with our values, but then you kind of get into it and realize it's just more of the same. Or cleanses. I'm hearing so much about cleanses. So that's really troubling. And then I saw there was a listener question. I think also seeing with COVID, right, a lot of talk about body size being a risk factor for COVID. And so now that kind of morphs into if you're fat, you're going to get COVID and die kind of thing. So a lot of fear, again, around fatness, but linked to COVID, right? So I think really taking advantage of our current chaos to kind of breed more of that. And so I think it's a great question about how to respond to that. Before the segment, Krista and I agreed that, we're not researchers, so we don't want to get into the weeds of like studies and statistics and that sort of thing. But there are studies out there that you can research to see that there is no causal link there between risk factors of COVID, mortality with COVID, and body size, and that actually, conversely, people on the higher end of the weight spectrum, or certain higher ends of the weight spectrum, BMI is not real, but if we kind of use that as a gauge, those are actually more protective factors, being in a larger body for certain diseases, including COVID. But there is research out there for that. And one other thing I would add, because of COVID and all of this resurgence in diet schemes, I think there's this feeling of need for control. Coronavirus is novel, right? None of us have had to deal with something like this before, and feeling dysregulated, I think, is very normal for our experience right now. And so it also is, I think, very normal to feel like I need to be in control. And when that happens in any time, oftentimes it's our bodies that become the target of that control, because it's kind of the most accessible thing for us to control. So then that looks like, restrictive eating and excessive exercise and just really dysregulated thoughts about our bodies. So it's like this feeling of I have to do something. So why not that and feel sort of productive? Pema Chodron calls it scratching the itch, right? Like we can't sit with the discomfort. We need to do something about it.
Right. And to top it off, you've got your Facebook suggestion of this diet, or your Facebook suggestion of, right, like buy into this, as you're saying, kind of scheme, dieting scheme, whatever, right? So we have all these also external reinforcement of those things that we all grapple with. Yeah.
Yeah, I think
Right, and
social media algorithms are definitely not our friend when it comes to this.
Yep.
So even if you looked up or you saw, oh, this person's trying this, and you looked it up, the algorithms are going to then start piling on all of the information, the articles, everything about how, being fat is bad. So therefore you're bad if you are, or if your weight changes in the upward direction, you must be even worse. And so it really gets reinforced through those algorithms. And I often share with people, be careful what you search for, because you're going to get that times 1,000. So if you're searching for, this ideal body that's not accessible to, most people, you're going to get a lot more information about that. And that will impact your body image issues. It'll impact the way that you think about yourself and others. So it happens quite a bit.
Well, and I think all of this, we did have a listener comment. So Rachel had said, many people are also struggling with depression and hopelessness during the pandemic, and this can be a barrier to healthy activity. It can also be a barrier, I think, to accessing healthcare, accessing mental health care. So I'm hoping that one of you could speak about kind of the impact that weight stigma and microaggressions around weight and body have on not only our mental and physical health, but again, our access to healthcare.
Sure. I can take that one. So access to healthcare is, one of the reasons why Thundermist wanted to respond to the impact of weight stigma on folks' health, because there's a plethora of research and data that shows that the focus on weight inside of healthcare is a major barrier, not only to accessing it, but to health. So folks are literally avoiding, like there's rates as high as 46% of women are avoiding healthcare appointments because of a weight focus or a fear of being shamed or inappropriate comments or equipment that's not the right size. There's other, data like, which was really shocking to me, is when they did a research of larger bodied women, 68% were avoiding cancer screenings. That's a lot of people who are not getting healthcare because it feels bad when they go in to have everything blamed on their weight. And so the what ends up happening is a little bit of a why bother? Like, if I'm going to go to the doctor and they're just going to say that I have to do this, or I'm going to need to do that to lose weight, then why bother going? I already know that I don't need to go. So we're really preventing people from having an experience with their providers where they can partner together and really talk about what's available for them and what's healthy for them in a way that they can access. Weight loss, and dieting fails 95% of the time. So let's get rid of weight as the measure for healthy behavior and really focus on the behavior for health benefits, period. So that's sort of the idea behind it.
Yeah, and what you're talking about, Krista, really suggests that the risk factors that are touted as weight, your weight is a risk factor, may actually be weight stigma is the risk factor, right? And so when we're talking about avoiding doctor's visits and we're talking about the stress and the toll that takes on you, that weight stigma and discrimination takes on you, just like we're talking about other groups, right? And bringing back to the race discussion, but that leads to poor health outcomes, right? If we're not getting our regular checks, if we're not addressing symptoms, if we're not getting the tests that we need based on our symptoms, because all that a doctor sees is that you need to lose weight, right? It's just focused on the body size. So then things are missed. And then when someone gets sick or dies, it's looked at as because they were fat, right? I don't use the obesity and overweight terms because, again, that's based on BMI and it's not real. And those are really stigmatizing terms, but it's really based on your size, that's why you get sick versus looking at weight stigma. And many of the research studies out there don't account for that at all. It's not even looked at. It's just looked at size, weight, BMI, that sort of thing. So really what we're suggesting is that you have to include those confounding factors. And that's the same thing with the COVID research.
when they do, just quickly, when they do control for that, they actually find that weight stigma has almost a stronger association with health outcomes than even a person's size. So when they do,
and that there's this causation that's implied when there is no proof of causation, right? And kind of mistaking correlation for causation, which is a research 101 no, right? But that's sort of what is implied. And, you know, I'll share personally that I have PCOS, and one of the biggest things with PCOS is restrictive dieting, right? Like cut out all of these food groups altogether, and weight loss and that sort of thing. And there's this idea that fat is the problem or the cause, when we know that people who have PCOS gain weight, or they're usually of higher weight because of PCOS, because of an actual syndrome. But then it's kind of flipped to look at weight as the problem, as the issue. And if you just lose weight, you'll kind of fix your problem, which is, of course, not true.
So all of this can make it, I think, so hard and confusing for people, right? To know, like, so what is self-care? How can I really take care of myself in a way that, you know, it encompasses what, you know, I need as an individual? And right. So, because you're getting it from your doctor, possibly, you're getting it from the health and beauty industry, right? You're getting it from
from your loved one,
from your well-meaning loved one. Yes, your well-meaning loved one. So taking all that in, right? What are some compassionate ways that we can care for ourselves when we're kind of grappling with all this input that we're getting that really is, you know, misguided and confused when we're talking about this topic? How can people compassionately practice self-care? We talk a lot about self-care here, you know, and we've even, Kayla, we highlight healthy eating, right? Well, what does that mean, right? When we even say that, you know what I mean? So what are some ways, Nicole and Krista, that we can compassionately care for ourselves, considering all this?
Yeah, I think that's a really great question. I also think it's a harder question than it sounds. I think first is, like I mentioned earlier, is curate your social media. What are you searching for? If you want a body positive or a body accepting or a body liberation feed, start searching for that. Look for the pioneers of a weight inclusive experience. Research them, you know, follow them, watch their podcasts, really get in there and sort of understand that this is a community that's been going on forever and has a lot of strength behind it and a lot of expertise for them to be out there. But the second thing I would say, and I know that I'm a therapist, so it sounds like I'm just promoting therapy, but as someone who does antidepressant therapy and works around weight stigma and body acceptance as a way there, I think really sitting down with someone who understands the impact of weight stigma and being able to disentangle what is, you know, from self-care, what is actually diet culture, or this assumption that, you know, following this rule is how you take care of yourself, when actually that's diet culture co-opting self-care. That often is the way to do it, because many of my patients literally have to break up with exercise to get rid of it's punishment for having a larger body or a body at all, really, and have to break up with that to learn what they actually like to do with themselves around movement. And a lot of them find out they loved to do it, but it always felt like it was, you know, you had to do it for this long, or there were these external, you know, rubrics of how they had to move in order for them to be compliant or adherent to weight loss strategies. That's my cat. So that really is one of the two things that I would recommend for folks to really do that.
I would just add to that, I think permission. You know, permission to take care of yourself. And I think also really an emphasis on community care, right? To Krista's point, like finding your community is really supportive. But permission to take care of yourself, which may look like resting, right? Sleeping when you're getting enough sleep. It may look like, you know, not forcing yourself to do some exercise when that's not really where you're at right now. Or like Krista said, like finding something that you actually want to do that's joyful. Eating for comfort, which gets a bad rep, is okay, right? Like that's listening to your body. Like, this is what I need right now. That might be hard for some folks to hear, but that's kind of part of the intuitive eating kind of mindset, right? And really, what are your priorities? I think of myself as a parent and how there's so many things to juggle, right? And feeling like you're like messing it all up. And how can I possibly do it all and protect my kid and teach my kid and do distance learning and try to keep us all from, getting COVID and that sort of thing. So one thing I would say to parents is that chances are, if you're treating and talking about your own body in a disparaging way,
Yes.
your kids are seeing that, and you may even be doing that to them without realizing it. And so it's really about kind of walking the walk and practicing this kind of mindset that if this is where you want to go with, body positivity, neutrality, body love, kind of whatever boat you're in with body, but really acting that parts, right? Like being that for yourself so that your kids are also picking up on that same behavior, that same mentality, right? Like not talking about how you look fat in this outfit or talking about diets and restricting food or doing that with your kids. Meal times can be battlegrounds for folks, right? And it's like so stressful. And when you practice something like intuitive eating, it can just kind of neutralize that, because kids are super intuitive. We're born with that intuition, with that gut instinct to eat when we're hungry and stop when we're full. And that gets messed up with all of this, like this diet culture stuff, right? So we kind of feel like, I think that it goes back to control in this environment right now. And some of that comes with controlling our kids' stuff too, right? And kind of like their behavior and what they're eating and what they're doing and all of that stuff. And we're so worried about, quote unquote, childhood obesity, and like they need to be moving and they're not in school right now, so they're not getting that same kind of level of physical fitness. And yes, like those things are important in the sense of that life enhancing movement, right? And those Hayes principles. But we don't need to be stressing about that to the point that we're so controlling about it, right? Or that it's so negatively charged, right? These things should be fun and enjoyable, not negatively charged. So I think just being mindful of your messaging, directly and indirectly, that you are sending to your kids.
Yeah, Nicole, I think there was a lot of pieces in what you just said that for me spoke to, this is intergenerational, and this is something that's been passed down in our society, especially for women. And there is, that idea of a toxic level of stress, right? If we're experiencing weight stigma, discrimination, it creates a toxic level of stress, which is where we're seeing both those physical health and those mental health outcomes that are negative from weight stigma. And there was just a piece for me in there that was very kind of going back to kind of early feminist movements when we were talking about liberation, right? And if we're in a toxic level of stress, we're moment to moment. And what could we do with that energy and that time if we are not being kind of, just hounded with this industry and this standard, right? In terms of body liberation, in terms of liberation for races and gender liberation. It's just like a really powerful message when we think about what body liberation can do for all of us if we are able to really kind of take on that idea and those principles. So I want to thank you, for both of you, for bringing those up, because I think these are really powerful messages for our community.
And I think we can all, I'm sorry, I think we can all relate to having some memory of experience with this in our formative years. One of my favorite podcasts is Christy Harrison's Food Psych. And the question that she asks all of her guests is, tell me about, growing up and how this topic kind of fit into your world growing up. And everybody has a story about, like growing up with, especially the women members of their family, especially, it's not just women, but mostly, always being on diets or talking about weight loss or going to, meetings, WW now, meetings together. And that, kind of was their support network and became very normalized, or being put on a diet for the first time when you're, single digit age, like 6, 7, 8 or something like that. Or realizing that you were different in a negative way because you're in a larger body as a child, right? And bullying and those sorts of things. So feel like everybody relates to this in some way in their formative years, even if you're in a thin body, right? Because the whole idea is that you can never be thin enough kind of thing,
Yeah.
right? So even in a smaller
Mhm.
body, you have experience with this, right?
Yeah. Well, and this brings me to one of a question that I think is really important for us to talk a little bit about, so that we know that online bullying and then those unrealistic and often artificial beauty standards now with Photoshop, with filters, and the increased access in social media, they're having a major impact on our youth, and we're noticing this in terms of mental health impact, physical health impact. Changes in healthy risk-taking behavior. So the things that are normative in terms of development are being shifted. We're seeing increases in suicide attempts. We're seeing increases in suicide completions. There's currently a call to create laws that would require influencers and celebrities to identify when they are doctoring an image, whether they're using filters or Photoshops. And I'm wondering what both of your thoughts are on this idea of kind of requiring certain people that have a really big impact on our society and on our youth to change the way that they are operating online.
So I can certainly talk about this from a systems perspective, where I think that when we start looking at individuals and trying to control their behaviors, including influencers and celebrities and how we're doing it, we're really actually saying that there is a systemic issue that needs to be handled, but we're going to try to put it on the backs of people who are using these tools to, whether it's make a living or whatever they're doing. And it's not that I'm saying that they're not damaging. I just feel like it's actually it's an avoidance tactic to actually deal with the fact that we don't have any laws to protect people regarding size except for Michigan. So there are no laws that that care for folks and make sure that they're not being oppressed or discriminated against around size. And so when I hear that, I think, oh, we're actually admitting that there's a problem, but we're not actually willing to solve it. We're looking at other ways to make sure it looks like we are.
Yeah, and I think we had talked about this before the segment. I think bringing it back to the parenting piece, right? And kind of like watching what your kids are doing, and also I think even more so just building that foundation for them, right? So like I was saying before, kind of walking the walk and sending certain messaging to them through your actions and not just your words, but also teaching and telling them about things like kindness, basic kindness, and that bodies are diverse, and that in the same way that we might teach a child about race and ethnicity and abilities and disabilities and religion and that sort of thing, and being inclusive in that way, we can talk about that with our body diversity as well. And something like when I was saying earlier about fat and kind of, taking that word back, kind of neutralizing it for kids too. And that it's not, I teach my daughter, like, fat is not an insult, right? Like in a certain context and the way you use it, it could be, but that's true of really any word, right? But that in our household, fat is not a bad word. It's not a negative. And she definitely has conflicts with that sometimes because she's getting different messaging from outside sources, right? But that we kind of hold that, we're grounded in our values as a family. And that's what we talk about when we're at home. So that really gives kids, doesn't prevent everything, but it gives them a good foundation to learn kind of how to filter stuff for themselves and like what actually matters.
I'm so glad that you also kind of kept highlighting that for us, Nicole, because as a parent, I think you're right. That is kind of where it starts. And to your point, Krista, this is such a systemic problem, right, that we have to come at it at many, many different angles. And I think that reminding parents just to start there is a really, really important one. So this has been amazing, but if people want to get involved, right, in this movement, if they kind of want to make a difference in their community, where do they start? Are there places that people can get more information or get more involved? What do we do? I'm just kidding.
So
what's next?
Yeah, I mean, there are certainly some organizations that people can look into. The Association of Size Diversity and Health, ASDA. We have the National Advancement for Fat Acceptance. which is NAFA. So there are certainly some larger organizations that have been doing this work for a really long time. But then there are a lot of local folks that are listed on, happens to be my website, but Shape Center Rhode Island, that are really doing great work. And there's nutritionists and there's health providers, there's therapists, acupuncturists, so all sorts of self-care places. So, we're meeting them and sort of building that community to get involved if you are someone who provides a service, including things like getting hair done. Do the chairs actually fit diverse body sizes? Like, really start thinking about whatever it is that you're doing. Are you thinking about everybody's experience, and how can you support more diverse body sizes to engage in your care or in your service? So those are some ways. And I think I mentioned earlier is to look up some of those pioneers in this work. You'll find communities through that. You'll find really great supports, really valuable information that can help you with whatever's happening. And that's sort of how I figured it out. And I think a lot of us figure it out that way, where you sort of, like each thing turns into the next thing. And then all of a sudden you're like in this world of acceptance and, and things that make sense. So that's sort of how I recommend folks do that. Nicole, I'm not sure if you have other suggestions for.
I would also add that if you're a practitioner in any of the helping fields, right, start to do that same research, right? Start looking into these different paradigms of care, because that's really where you can make a huge difference with your clients, with your patients, is learning a different way of care that really is holistic healthcare. And there's, a lot of certification courses out there, like intuitive eating, like Body Trust. But even if you don't go for certification, there's a ton of stuff out there that you can read, that you can listen to, that you can watch, that you can even just get, a course, sign up for a course or something, right? And kind of get steeped in that. But that's what I would recommend if you're a provider, is, this is how you can help better treat your clients and patients who trust you, who rely on you, who need you.
Well, thank you both so much for so much for being here. This has been so informative and helpful, and it's revolutionary, and we are so thankful for you coming on and really, talking about this issue, because it doesn't get enough attention, and it does intersect all of these different issues that we're talking about. So thank you again. And thank you to all of our listeners and people that were out there watching and who are going to watch later. We look forward to coming back, in 2 Wednesdays to discuss more topics related to coping with COVID-19 and beyond. And if you have a particular topic that you would like us to discuss, please leave it in the comment or send us a Facebook message.
And please remember, if you or someone you love is struggling with managing stress or anxiety at this time, we want you to know that this is hard, and to please reach out. We have clinicians who are available to assist you through telehealth services. Thank you, everybody, and be well and be safe.
Thank you.
Thank you, guys.
Thank you. Take care.